Pharmacological management of hypertension. The learning outcomes are as follows. Explain when to start antihypertensive medications. Describe the stepwise approach to pharmacological treatment for hypertension. Explain antihypertensive treatment in the presence of comorbidities. When to start a drug. Once hypertension is confirmed, it must be identified whether it is grade 1 hypertension or grade 2 hypertension. If it is grade 1 hypertension, grade 1 hypertension with low to moderate cardiovascular risk and no hypertension modified organ damage, drug treatment 3 to 6 months after lifestyle intervention if blood pressure is still not controlled. Grade 1 hypertension with hypertension mediated organ damage or high cardiovascular risk, that is, presence of cardiovascular disease, diabetes mellitus, CKD, or estimated cardiovascular risk greater than or equal to 20%. Immediate drug treatment should be considered. If it is confirmed grade 2 hypertension, immediate drug treatment should be carried out. The drug treatment strategy has a stepwise approach which is recommended. It consists of 4 steps. This depicts the stepwise approach to pharmacological interventions. If the patient has low risk grade 1 hypertension, patients greater than or equal to 8 years, patients with frailty. If yes to any, step 1 monotherapy. If not controlled, step 2 dual full dose combination. If uncontrolled, step 3 3-drug combination. If still not controlled, step 4 4-drug combination. If there is no low risk grade 1 hypertension and the patient is not greater than or equal to 8 years and the patients do not have frailty, if no to all, step 1 would be a dual low dose combination. Please refer this chart carefully to identify the therapeutics of this situation. In all the steps, beta blockers should be considered in the regimen in those with heart failure, coronary artery disease, atrial fibrillation, pregnancy, or planning to become pregnant. The beta blockers recommended in heart failure include carvedilol, metoprolol, and bisoprolol only. The beta blocker recommended in pregnancy or in those who are planning to become pregnant is labetalol. Antihypertensive treatment in the presence of comorbidities. In this chart, antihypertensives considered in diabetes, coronary artery disease, heart failure, chronic kidney disease, and post-stroke are depicted. Please study this chart carefully to identify these therapeutics. Summary of hypertension medication is depicted in this chart. Each of the drugs or drug classes, the contraindications, and where careful administration is required is depicted. Thank you.